Good afternoon and welcome to our weekly COVID press conference that we provide you with information, the latest information on what's going on. I'm Larry Holsey, Director of Municipal Information and Communication for the City of Waco. I'll be the moderator for this, and again I'll introduce you in a moment our panelists and everything, but I want to remind you that we are in our studio downstairs providing an American Sign Language interpretation. We're also recording a separate audio track for our Spanish listeners and viewers, and that'll be airing this afternoon at 4:30. And always so gracious to join us initially here is our Mayor Pro Tem, Hector Sabito, to invite our Spanish speakers to join that. Hector, will you join us? Help us invite them.
Good afternoon. Thank you, Larry, so much for the invitation. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esa grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you again for the invitation.
Thank you for always joining us and helping us provide that information out there. Joining us today virtually are our panelists. First of all, Waco Mayor Dylan Meek, McLennan County Judge Scott Felton, Dr. Jackson Griggs, CEO of the Family Health Center, Dr. Brian Becker, Chief Medical Officer for Ascension Providence, and Dr. Umad Ahmad, Interim Chief Medical Officer for Baylor Scott & White. And we also have in the picture today, we have Kelly Crane with the Health District to help us if we have any other questions or they want to address any of those too. We'll go through the same routine we've done before. We will go and let each one of you make a comment, and then we'll open it. We do have 3 media representatives who are registered today to ask questions. We'll do 2 rounds of 1 question each. And then we'll let the mayor wrap us up. So let's get started. We'll go in the order of our mayor first, and then we'll let Judge Felton go second, followed by Dr. Griggs, Dr. Ahmad, and Dr. Becker in that order. So, Mayor, would you kick us off?
Good afternoon, and I appreciate everyone taking time to join us today. Thanks for the panelists on this call. The guys on this call are very busy, and I just want to say again, your willingness to communicate to our community is outstanding. I did want to announce that we might be making a shift in the format starting next week to showcase doctors or other healthcare experts from some of our hospital systems. And in lieu of only hearing from our chief medical officers, we're still finalizing this, but I do know Dr. Griggs and Judge Felton and myself will be present whenever we can be, in addition to other representatives potentially from these hospital systems. As I've said in the past, our local hospital systems, city staff, county judge, and myself are in close, regular contact as we discuss and monitor data regarding our hospital capacity. And I think Dr. Griggs is going to give us some hopeful data here in a little bit. And in light of that, at this time, the alternative care site continues to be more improbable than probable, but we'll continue to monitor this data closely and ensure that we have a good plan for the citizens of this community. Our local doctors continue to advise us of the seriousness of this virus, and I just continue to urge our community to make wise decisions, continue to listen to our doctors by masking in public, following safe distancing protocols, and washing our hands. Following these doctor-endorsed protocols is certainly the right move in this time. And as a reminder, at the present time, Texas mayors and local governments have almost no policy-making authority. Governor Abbott has implemented and has control of the regulations and mandates, from wearing masks to closures of bars and occupancy requirements. The governor has issued an order stating we can't issue more restrictive orders than him. We've not heard any word from the governor's office that this might change. The Waco and McLennan County Emergency Operations Center is working with the Texas Department of Emergency Management and DOC's health testing to provide COVID-19 testing to our community. When you register online, it does ask for your insurance information. You do not have to have insurance to receive a test. For people with insurance, there is no out-of-pocket cost or copay to get the test, and please go to covidwaco.com to register. As I've said in the past, we continue to enter into a more hopeful stage of this journey we're on. Dr. Griggs, like I mentioned, will tell us some more hopeful data, and we also are working hard to ensure that our community can get vaccinated. And that is something to celebrate. As a reminder, there's a lot of local organizations that are giving vaccines. We call these vaccine providers or just providers. A list of these providers is on covidwaco.com and includes organizations like CVS, HEB, Berkshire Brothers, and our hospital systems. And then one of the many providers is our own public health district. Also, as a reminder, our local government has no authority or control over any of the other providers, but we do work to collaborate and partner with the providers when we're able to do so. And now for an update on the Waco and McLennan County Public Health District's vaccination clinic. We are in our 4th week of offering COVID-19 vaccinations as one of the state's hub sites. The Public Health District's clinic has held last week. The clinic last week ran very smoothly and had just over 1,800 vaccines being administered with no wasted doses. 1,615 of these were first doses and another 198 were second doses. At last week's clinic, the patients who were served were 68.4% white non-Hispanic, 13.3% Black or African American, 12.8% Hispanic, 1.1% multiracial, and 1.1% Asian, and 3% multiracial or another race. This week, we will hold our first drive-through clinic at McLean Stadium on Thursday, Friday, and Saturday, and will not be hosting a clinic at the Waco Convention Center. The clinic is by appointment only, and we will continue to make appointments from the wait list. Be sure to check your email and answer your phone if it is from a 750 number. Participants will receive directions to the stadium site when they schedule their appointments. Please do not go to the stadium unless you have an appointment. A big thank you to Baylor University for partnering with us to help host this drive-through clinic by facilitating the stadium and contributing staffing, logistics, and planning resources to help make this clinic run smoothly. Also, thank you to MCC for providing so many members of their nursing clinics and program as well. We have so many great community partners who are making sure that this vaccination effort is a success. Vaccine supply remains limited, but we will continue to receive allocations and we will continue to host clinics. Please reach out to your family and friends who may not be comfortable with the process or have access to devices with which to register, and offer to help register them for the wait list. Registration can be done online at covidwaco.com or by phone at 254-750-1890. We have a call center staff working evening and weekend hours to schedule appointments every week. There have been many questions about the second dose of the vaccine. If you received your first dose from the health district, you will be contacted by the health district when it is time to get your second dose. You do not need to get back on the wait list for your second dose. The state is sending second dose allocations at the appropriate time following the first doses administered. At this time, the state recommends that individuals contact the provider they received their first dose from in order to schedule their second dose. To date, the health district has been administering the Moderna vaccine, which requires at least a 4-week period between the first and second dose. The health district staff does not schedule appointments until the vaccine has been physically received. Next week, individuals from the health district clinic held January 12th through the 14th should expect to be contacted to schedule their second dose. Please continue to have patience. The availability of the vaccine is limited within our community. We understand the importance of the vaccine and the hope that it brings, and we will continue to distribute it as quickly and as efficiently as possible. Your city and county leaders, along with many other community partners, are working diligently to provide a data-driven case to our state and federal representatives of the need for increased vaccine allocations to McLennan County and our region. So with that, I will turn it over to our judge, Scott Felton.
Judge Felton?
Good afternoon. Last week's clinic totaled a total of 19 counties were served, and 93% of the appointments served are McLennan County residents. There are some people from adjoining counties that come in for their vaccine in this area, but we also have residents of McLennan County to go outside of our county to get vaccines as well. Since the first shipment of vaccine in December, the Waco and McLennan County Public Health District has vaccinated 5,204 people. According to the Texas Department of State Health Services dashboard, a total of 16,621 people in McLennan County have received their first dose, and 3,149 have received their second dose. This could not be done without the support of the community and the many local providers within the county. Whenever you, whether you're in the city or county employee, a volunteer, or you help someone register for an appointment, you have made a difference in the lives of many people. Thank you for your patience as you work together to vaccinate our frontline and our most vulnerable citizens. Vaccine supplies remain limited across the country. It will take time for McLennan County to fully vaccinate everyone in Group 1A and 1B. As Mayor Meek said, we continue to advocate the need for increased doses in McLennan County from the state. However, we do not expect an increase to our allocation until our allocation supply improves. This should have happened in the coming weeks and months as new vaccines are approved and vaccine manufacturers increase their capacity. As you know, Johnson & Johnson is in the news a lot about hopefully getting an approval here fairly quickly, and there's possibly be a one-dose vaccination, which would really help cover the county much faster. We have just under 30,000 people on the health district's vaccine wait list. Please continue to encourage all eligible individuals to get on the wait list if they're not already on one. And remember, the health district is not the only provider, as Mayor Meek has just mentioned. There are many providers in McLennan County and throughout the state, so continue to check in with them for available appointment times. Some good news yesterday is you may have heard is CVS announced that they'll be providing vaccines to eligible residents under the Phase 1A and 1B state vaccines plans. And looking at the amount of allocation they'll get from the federal government, it should be significant. So they'll be a big player in our county. I want to make a promise to everyone that Mayor Meek, State Representative Doc Anderson, State Senator Brian Birdwell, and myself are continually in contact with the Department of Health Services and making our case to get increased dosages into our county. We are dedicated to make this happen. We want to make sure that the state understands that we've got some levels much higher than other counties, and that we deserve a larger allocation this time. So thank you very much, and I feel very hopeful that we're starting to see some positive things happen. Thank you.
Thank you, Judge. Let's go to Dr. Jackson Griggs, CEO of Family Health Center. Dr. Griggs?
Thank you, Larry, and thank you, Judge and Mayor, and Dr. Ahmad, Dr. Becker. It seems like we don't go very long these days without seeing each other on screen at least, so nice to see you again. Jumping right in with McLennan County numbers, there's a total number of confirmed cases in the county to date of 23,444. 736 of those cases are currently active. As of this afternoon, the Public Health District has received notification of 111 new cases of coronavirus. 89 people are currently hospitalized at Ascension Providence and Baylor Scott and White Hillcrest, and 21 of those patients who are hospitalized with COVID-19 are currently receiving ventilator support. Incidentally, I think it's clear, but let me just restate that it's 89 who are currently hospitalized with COVID-19, not obviously not the total hospitalization count. We have, unfortunately, we have 4 additional deaths to report today. So we have seen now a total of 370 total deaths in our county due to this virus. Within long-term care facilities in McLennan County, currently there are 10 facility outbreaks. There's also 10 active cases among patients and staff in these facilities. And there have been a total of 122 nursing home related deaths to date due to COVID-19. At the county jail, there are currently 13 active cases. There are no current church clusters identified within McLennan County. There are 14 independent school districts and no private schools that are reporting cases on campuses right now to the health district. There are a total of 42 specific school campuses, so that's 14 districts, but 42 school campuses with active cases. And within schools, there are 105 active cases. 74 of those are students and 31 are staff. So I'm going to transition to showing our current incidence slides. So here is the good news. This is what we're so excited about, and that is that our new cases have continued to drop and are now at 17 new cases per day per 100,000 in our population on a 7-day rolling average. And that is the lowest incidence, the lowest number of new cases per day that we have seen in 5 months. So we're just as excited as we could be about that. So where that falls in the sort of strata of spread is it's above that community spread threshold, but below the tipping point in that accelerated spread phase. So we you see the color there. The color choice there is orange to represent that there's still risk, but we're not nearly at the risk of exponential spread at any given day that we were even just a month and a half ago. The next slide here reflects our positivity rate. You can see that our positivity rate is at 12%, which is below the state of Texas, but we're not quite at that mitigation threshold. Remember that the way to get the positivity rate down is to increase the number of tests that are being performed in a community. So this number, a lower positivity rate means that we're discovering a sufficient number of viruses that are out there in the community to mitigate the spread, and ultimately, if we get it less than 3%, we really stand a chance of full suppression of spread from person to person. More good news, and that is that the number of confirmed COVID-19 positive patients admitted to hospitals continues to be on the downslope. So right at first, we were almost scared to be too optimistic, and so we were saying that, you know, maybe it's not a trend, a meaningful trend yet. Well, we do see clearly a meaningful trend at this point, and so we're very happy about that. And the chief medical officers, I'm sure, will offer more detail momentarily. This slide is probably the most troubling because this demonstrates by month the number of deaths that we've seen in our community. Each one of these deaths represents a human life cut short, and a person who was connected to the community, a mother, a father, an aunt, a brother, sister, or child. Although when I say child, I mean offspring, not necessarily. We have not seen any pediatric deaths in our community. But what you see here in January is that there were a total of 76 deaths. So our second highest fatality count in January, with December being 84. We do expect that February will see fewer fatalities as we see that hospitalization trend on the downslope and obviously the incidence trend on the downslope as well. Now I want to share just a quick update on the emerging variants. While everything that I have shared about incidence and hospitalization is good news, we are at a point right now where we're identifying new variants of this virus that are occurring globally and in our country. And let me pause real quick to try to explain why we're seeing mutations that are meaningful across the globe. So there is a constant rate of mutation when there is a virus like this, like the coronavirus, in a person's body. Every time the virus multiplies, there is some very, very, very small risk that a mutation can occur in the genetic code. If you have, let's say you have a very small population, 100 people total with a given virus, well, the likelihood that there's going to be a meaningful mutation that occurs in all those, in the virus that's multiplying in those 100 individuals is very low. But once the count of individuals is measured in the millions and the number of viruses that are actually multiplying are in the quadrillions, there becomes a much higher risk of a meaningful mutation. Most mutations, they end up not mattering at all, but once in a while, just by sheer number of mutations, there's going to be a virus that's a little more fit, a little more likely to survive or have some advantage over the viruses, the other viruses. And these are the ones that we worry about. So just by sheer volume of virus that exists on the planet Earth right now, we're seeing more mutations. So once we have an ample number of people vaccinated across the globe, we will see fewer mutations emerge. But I wanted to address why it just seems like all of a sudden we're starting to see some emerging variants that are concerning. Well, it's because we're seeing so many people across the globe who have this virus. So quickly, let me run through the three variants that are most concerning right now. The B117, the UK variant. Initially, we were reporting that it was more transmissible, but then last week I shared that there was some new data that suggested that it is possibly more fatal. To be clear, it is the lead scientists in the UK said that it was 30 to 40% more fatal. There was some preliminary data that gave fatality rates that were even higher than that. But that's 30 to 40% more than the current case fatality rate. So just to be clear, that does not mean that 30% of people who get this variant die from it. It is 30% higher than the base rates of mortality due to this virus. The second, incidentally, it's this is the CDC's update as of February 2nd. That virus variant has been identified in 33 states. The B1351, the South African variant, it is likely more transmissible and possibly less responsive to the vaccine. There are some preliminary evidence that the vaccine is not as effective. It has appeared in two states. There have been 3 cases in the United States. But to be clear, when I say less responsive to the vaccine, when we're looking at response, we're looking at any symptoms at all of the novel coronavirus, any symptoms at all of COVID-19. The outcomes that we're really interested in, I mean, as a community, are less severe cases, so less hospitalization and less death. There isn't data that I'm aware of at this point that would suggest that any of these variants are causing the vaccine to change those really important outcomes of hospitalization and death. But it may make the vaccine less active just in terms of preventing any symptoms at all. Of course, as we get more data, I'll share it. We'll obviously it will be all in the media as well. So the P1, the Brazilian variant, there are some mutations in this variant that may decrease its ability to be recognized by antibodies. Antibodies are first line of important immune response to a virus to eradicate the virus. So that is early in right now in terms of our understanding of this Brazilian variant. Again, more information will be forthcoming as it's discovered. It's currently only been identified in one state. So let me just kind of wrap up with a few final comments that address some questions that have come up since last week. As we see a new decline in hospitalization and cases, the question arises of what accounts for this good news. Well, all of the numbers, whether they're good or bad, reflect the end result of multiple factors. So this is an ecosystem, not a simple machine. Our present good news, I think, reflects the fact that compared with the holidays, household members aren't gathering as much with people outside their home, and people aren't hosting events as often within their home. I think it may also reflect the ongoing work by the community to stay masked and to keep socially distanced. My suspicion is that as we were sounding the alarm and as you were seeing it in the media that our hospitalizations are getting packed, people are dying at higher rates, that there was a real and meaningful response by our community in terms of masking and social distancing. And there may be other factors at play as well. But I do think it's probably too early for the vaccine to be making a population level difference. But when that does begin to occur, it will be both vaccine and a decrease in new cases because of the number of individuals in our community that have been either symptomatic or asymptomatic. And whenever that sum total vaccinated plus those who've had the infection reaches a certain threshold, we will see the numbers begin to decrease and to stay down. But right now we're kind of in a race against the clock with these new, more contagious variants that are emerging. And I'm not aware of any facilities in our community that are routinely sampling for these variants, but we can assume that what's happening across the country is also happening locally. There's nothing that would make us special such that we wouldn't be that we wouldn't have eventually these same variants that we're seeing across the country in our own community. So we all, I think, should feel a sense of excitement and momentum in this direction right now. Now is the time to get tested. If you're symptomatic, even mildly symptomatic, if you think you've been exposed to someone who has COVID-19, please go get tested. We've got to keep driving that positivity rate down. Let's capitalize on this momentum. We have seen a decrease in public testing as well as testing at healthcare, in our healthcare system, and I think we need to turn that around and see a rise in our testing in order to keep driving the numbers in the right way. That's the only way we can identify the lurking cases throughout our community, isolate those individuals, quarantine those who have been exposed, and stop transmission in its tracks. But we've got to test in order to discover. So I would just encourage us all to be really aggressive with testing right now. And of course, we can't let up on our diligence in terms of masking and social distancing. The end is in sight. We're counting months down now, but we've got to persevere to the end of the race. There's only one other question, and that was around, we call them antipyretics. They're medicines that are Tylenol or acetaminophen, ibuprofen, and it's Advil, Motrin, and these medicines to use, to treat some of the body aches or chills that we can get as side effects to the vaccine. And while there are individuals who may not need to take those medications for medical issues, the CDC says that taking these medications in general, taking these medications to treat the side effects of the vaccination is fine, but they do not recommend, the CDC does not recommend routine treatment to prevent side effects from the vaccine. So don't just take Tylenol or ibuprofen just because you're afraid you might have some body aches or chills. But if you're someone who your primary care team has said, yeah, it's safe to take those medicines, and you get some body aches and chills, it should be just fine.
Okay, thank you, Dr. Griggs. Now let's go to Dr. Ahmad, Interim Chief Medical Officer for Baylor Scott & White. Dr. Ahmad.
Thank you, Larry, and thank you, Mayor, for having a weekly up-to-date conversation between the community and us, and giving us an opportunity to send our message out. The state of the hospital is going in the right direction. As Dr. Griggs said, that it is a trend now that we are seeing for the last 2 weeks. Our numbers are lower, and we hope to continue seeing the trend in the coming weeks. It could not have happened without the support of the community, including your social distancing, masking, and hand hygiene. Remember, in the coming week, you have a Super Bowl event. Please continue that through this weekend. I request you to do not get carried away with the positive, especially with the event coming in this weekend, and continue social distancing, hand hygiene, and also your masking. While the healthcare systems are feeling a little better, we're also working with our partners in the community and outside the community itself in the state of Texas for vaccines. Baylor Scott & White system has multiple hubs in multiple locations. We are fortunate to have 2 hubs in our own community, and we are teaming up with Mayor Meek and his team to vaccinate our colleagues and our 1B patients. We are still applying for further vaccines to be available as they are in limited supply. And we do intend to risk stratify and get in touch with our high-risk population to get them vaccinated when the vaccines are available. In the meantime, we do encourage that our population and our patients do seek the resources the city has provided and get vaccinated while we are helping them and will assist them during this process. Do not forget to visit our website and make sure your information is up to date so they can get in touch with you when the vaccines are available. No matter which source it is, we need to get all of you vaccinated by the end of the day. There was a question about limited ability to do COVID testing with other platforms. In our internal due diligence, we realized that there has been platforms available internally, and we have been using it for months, where we not only use COVID testing depending on the symptoms, We check other respiratory panels also, like RSV or influenza, and we check them also when you come to the hospital. So rest assured that you're not only getting COVID test, you're getting all the respiratory panel, and we are excluding and taking care of other potential possibilities. As far as the different variants, Dr. Griggs mentioned very beautifully the different variants. We are randomly sampling genotypes in Temple region, and we have identified only one South African strain since we have been sampling in early December. So as Dr. Griggs said, we are not going to be unique in our location. We will have the same trend as rest of the nation. Last but not the least, I want to applaud the frontline team members, our community leaders, and our colleagues who have been diligently working with us. Please, again, do not forget to social distance, hand hygiene, and face mask, even if you're vaccinated, till it's been eradicated. And that's the only way we can get off this hump. Thank you, and I'll be happy to take questions later on.
Thank you, Dr. Ahmad. Let's go to Dr. Brian Becker with Ascension Providence.
Hey, good afternoon. Thank you, Larry, and thank you, Mayor Meek and Judge Felton, for your continued leadership in our local communities. I'd like to start by expressing extreme gratitude to our frontline workers here in Waco, across the state, and honestly across the country, who have remained dedicated to providing the needed healthcare services amidst the global pandemic. As we approach 1 year of the virus in our local communities, I'm reminded daily of the sacrifice that have and continue to make, that these people have and continue to make, and to know that the amount of gratitude that I can express is going to be insufficient, but always, I think, important to keep those folks front of mind. I'm grateful to report again this week that we continue to see ICU numbers that are declining, along with the decline in overall COVID hospitalizations in our healthcare system. In fact, we're seeing approximately half the COVID cases that we were seeing just a week ago, and also at the start of the new year. For the first time in months, we have seen a significant drop in hospitalized COVID patients, and that has allowed us to return to routine surgeries. We have resumed non-urgent and non-emergent procedures for the first time in 2 months. And we evaluate daily our ability to continue to provide these services in accordance with the governor's executive order. If staff and resources allow, we hope to continue with non-urgent and non-emergent procedures as we look ahead, and hope to return to normal operations if the numbers continue to decline. To date, Ascension Providence has provided more than 10,400 vaccinations to individuals in our local community. As was previously discussed, Ascension Providence has been designated as a COVID vaccine hub by the state, and we've been working to launch a public website and phone number for vaccine scheduling. We launched both the website and the phone line on Friday of last week, and individuals can access appointments online at healthcare.ascension.org/COVID-19/vaccinations, or they can call 1-833-604-1626. Appointments were made available beginning yesterday following vaccine delivery, and we expect additional appointments to be available each Tuesday afternoon pending vaccine availability and delivery. Again, this is just one point of access for vaccinating high-risk individuals in our local communities. Ascension Providence continues to partner with pharmacies, nonprofits, and school districts to deliver vaccines to other high-risk communities in Waco and McLennan County. In fact, Ascension Providence will be partnering with Waco and Midway Independent School Districts to offer vaccines to their at-risk staff beginning this weekend. Our overall goal remains to continue providing vaccines to as many high-risk individuals in our local communities as is possible, and our focus continues to be on those individuals in priority groups 1A and 1B, as is defined by the Texas Department of State Health and Services. I'd be remiss if I didn't thank the community for ongoing outpouring of support for how they have shown to our caregivers. I'm often asked what community members can do to give back to our staff, and right now the best action that they can take is to continue to do their part to stop the spread of the virus and to be vaccinated when given the opportunity to do so. It's going to take some time to vaccinate all the members of our community. In the meantime, and even after being vaccinated, We continue to urge you to please practice social distancing, continue masking, continue to follow all the guidelines put in place by our health authorities. It is making a difference, and it is crucial that we all remain diligent in these actions. So again, thank you for asking me to participate today, and I look forward to questions.
Thank you, Dr. Becker. Okay, we have 3 media representatives on the phone on the Zoom call that have registered. We have Rihanna Sagert with the Waco Tribune Herald. We have Hannah Hall with KWTX News Channel 10. And we have Sierra Shipley with KXXV News Channel 25. We'll go in that order. Each one will have one question, and we'll do 2 rounds, so they'll each get a total of 2 questions. So let's start with Rihanna Sagert with the Waco Tribune Herald. Rihanna, you on the line?
Yes, thank you. My first question is, who determines which hospitals test for those variants? Did Hillcrest take that on? Did the state facilitate it? And will other hospitals also start doing that testing?
Dr. Ahmad or Dr. Becker, going to?
I can give an answer probably to relate to all my colleagues. There are very limited sites where the genetic testing can be done and variants can be done. So the only site we have in the local nearby facility is in Temple, and they do random testing. State has its own testing that they do randomly, and I'm not sure how many they take from Waco to sample that. We cannot test everybody, and it's not practically possible to get that kind of genetic testing available to us in the short term in Waco that I'm aware of.
Okay. All right, thank you, Rihanna. We'll be back to you with another question in a moment. Let's go to Hannah Hall with KWTX News Channel 10. Hannah, you on the line?
Yes, I am. My first question is there a community impact because the vaccinations have been happening relatively slowly, and what would that impact be of a slower vaccination rate in our area?
Dr. Griggs, do you want to try to field that?
Sure. Hannah, the longer a pandemic exists without a prophylactic or preventative strategy, the more the impact is going to be. So in this, if it had taken as long as I thought it was going, I was initially projecting, that it was going to be spring or summer before we were going to see vaccines. I was just thrilled that we saw vaccines that were safe and effective before the beginning of this new year. I see Texas as a whole is not is kind of lagging a little bit other states in terms of vaccine rollout, but I see our community among Texas communities getting its fair share of vaccines. I think that we are getting them to the individuals that are in 1A and 1B preferentially. So in terms of the rate, it's, I guess you could say Texas might be a little slower than other states, but we're early in the race here and we're lagging behind just a little bit, not a lot. So I think the premise of the question, whether the slowness of our rollout has made an impact, might just be, you might just tweak the premise just a little bit because for 2 reasons. One is the overall length of time before vaccination occurs is going to obviously have an impact in terms of hospitalizations and death, and that we may not be really all that slow compared with other communities in terms of rollout, at least communities in Texas.
Okay, Hannah, thank you for your call. We'll be back to you in a moment. Let's go now to Sierra Shipley with KXXV Channel 25. Sierra, you on the line?
Hello, yes, good afternoon. So McLennan County has seen some of its worst hospitalization rates last month since the onset of the pandemic in March. Now we're finally seeing a decrease in these rates. What would you credit this sudden decrease to?
I'll let any of the hospital leadership or Dr. Griggs field that. Any of y'all have a medical?
I will pretty much give the same answer Dr. Griggs presented in his presentation. There are multifactorial factors. Obviously, community played its role in social distancing. The holiday seasons has gone away. The schools are opening and the traveling has cut down. And there might be some role from vaccination, but we are not sure how much role it has played because 1A community, which is the healthcare community, including many of us, have been vaccinated and we are still part of the community, and we do help to reduce the spread with vaccination, but it may not be the major contributor.
Dr. Becker, did you want to reply as well or not?
I would agree with Dr. Ahmad. I think it really is a reflection of getting out from the Thanksgiving and Christmas holidays where folks were gathered. And as we've gotten out now a month from the last of those, I think those exposures, those infections, and those resulting hospitalizations have started declining. And so we're back at a baseline, normal, everyday activity for our community, which is where we found ourselves before this began.
Okay. Thank you, Sierra. We'll be back with you in a moment. Rhiannon, back to you for another question.
I don't have a second question. Thank you.
Thank you very much. Let's go to Hannah Hall. Do you have a second question from Channel 10?
Yes, I do. So this is a little bit addressed earlier, but we know there are still a lot of people that are having a hard time getting their first vaccine. We know the second round is coming. Is there any idea about when we'll start getting a larger number of doses so more people can get vaccinated? And does that cover the people who are scheduled for second doses as well?
Sure. Hannah, I'll take a stab at trying to answer that. So we don't know exactly when our county will see more vaccines. That is something that the state distributes and has authority in making those decisions. We do have a team of folks here in McLennan County who are trying to put forward a data-based case for why this community does need more vaccines, and it is ensuring that we are making sure that decision makers are well equipped with the information of the need here in McLennan County. In addition to that, in regards to the second vaccines, the way my understanding, and anyone on the panel can step in here if I misstate this, but my understanding of how the state is operating this is that when a first vaccine is given, the state has a second batch of vaccines already allocated to follow those up. So if you've gotten your first vaccine from the health district, the next vaccine, we'll be getting a special batch of vaccines for that second dose that you'll be given. Kelly, is that right? I think Kelly Crane's on the line too. Did I state that correctly?
Yes, that's absolutely right. For our vaccination clinics, our first round of second dosers will start next week, dependent on if we receive the vaccine, which we are expecting to receive the vaccine. The state has honored their commitment every week.
Good. Thank you, Kelly. Anyone else have anything else to add to that response? Thanks, Hannah.
Can I ask a follow-up question to that question? I know it kind of only counts as two. Is that the case also still for people who go to Brookshire Brothers or HEB or something like that? Does the state still allocate a second round the same way?
Kelly, do you know that? Yeah.
That is my understanding. We don't get a lot of information on those other providers, but that has been the state commitment from the beginning, yes.
Okay, thank you.
Okay, Hannah, thank you. Final question from Sierra Shipley from KXXV Channel 25. Sierra?
Thank you. So you mentioned that the credit to this decrease was from the holidays that we have just went through and passed. Do you feel the vaccine and it playing a role in that decrease? Do you think it'll be a while before we see the vaccine playing a role in that?
Dr. Griggs or Becker or Ahmad, do y'all want to respond to field that?
There's been little samples of the population that have been tested that have demonstrated what's the asymptomatic rate of spread. And I'm starting here to answer your question because it's important to recognize that we have our case counts, known cases. Then we have the asymptomatic cases that were never counted, but they did occur, and individuals developed some degree of immunity when they had that asymptomatic case. And then built on top of that, we have those individuals who are vaccinated. And it's the sum of really all three populations, those asymptomatic who became immune, the symptomatic who were counted, who became immune, and those that are vaccinated. Once that reaches the threshold of herd immunity, which, while you heard originally there was some guesswork saying 60 to 70%. It looks like now 70 would be the very probably lowest threshold, and it could be as high as 90% of the population needs to be immune before we'll see herd immunity. But it's the total of the immune population, the aggregate immune population that has to reach, whatever that threshold is, 90%, in order to have herd immunity. And so we are, and that's when we begin to see, sustained decrement in case counts and ultimately eradication of the virus, a new incidence of the virus. So, I did read one study. This may be a little optimistic, but that said that asymptomatic rates were as high as 4 times what our case counts were. And if that's the case, then, we have 23,000 known cases in our county. Multiply that by 4, and that's the asymptomatic numbers. And so as high as, we may be, with all of our, vaccinated population right now, plus all of those who've had, maybe we're at 40, 50 max % of our community who is immune. But I think those are optimistic numbers. But that's kind of how I'm processing. Where are we in the journey towards herd immunity?
Okay, thank you very much, Sierra. Well, that's going to wrap up the media part of this. And Mayor, I'm going to turn it back over to you for final comments.
Sure. Thanks to the Family Health Center, Baylor Scott & White, as well as Ascension Providence, who, as we know, is one of the hubs here in McLennan County and who I know is working diligently to distribute vaccines they've been given here in McLennan County. This process has proven challenging for all of us, but everyone is working hard and working together. We're in this together, and I'm so appreciative of our health care systems that truly care about our community. Communications regarding vaccines and COVID in general are and will continue to be challenging, but we're making a good progress in distributing vaccines to our community, and your patience is appreciative. We will continue to communicate through our weekly update emails, our website, this press conference, social media, town hall meetings, one of which was recently done with a variety of leaders, including our own council member, Hector Sabito, as well as coordinated messaging and outreach to neighborhood associations, local faith communities, local businesses, grassroots organizers, and local nonprofits, with a focus on ensuring vulnerable populations are given fair and equitable access to vaccinations. So, thanks to our frontline workers, Judge Felton, McLennan County, our health district staff, our city manager, our deputy city manager, our assistant city managers, our city attorney, and our city secretary. I've seen each of you and your teams doing the good, hard work to make sure that our city is moving in a positive direction, and I really thank you for that. So that's all I have today, Larry.
Well, I want to thank all of you all for participating, as always, in the time you give to this and the research and the preparation you get, because I know we do send you some of the questions that we've received and things like that. I want to remind our viewers that this will have a complete replay in Spanish at 4:30 and a complete replay in English at 7, and it's always available on demand on our same website, wccc.tv. A couple other quick reminders. Don't forget your flu shots. It's still flu season. I think the doctors would all agree it's still very important for that. And always go to covidwaco.com for the very latest information. And if you've signed up for the wait list, be watching for a phone call from a 750 phone number. That's probably the city trying to call you if you're on the city's wait list. If you're not on the wait list, go to covidwaco.com. You'll find the big red circle that says sign up for the wait list. And those are some of the critical things that we want to help you understand too. So we hope you appreciate the information here. That's all we have for you today, and we'll see you back next week. Have a good afternoon.
So you just can't wait. but you keep on trying, and you might just win. Keep on trying, and you might just win. Keep on trying, and you might just win. Thank you, Waco.
Good morning and welcome to City Talk. It's a weekly radio program, it's a podcast, it's a TV program. It's an opportunity here at the City of Waco for us to communicate with all of our citizens and all our viewers and listeners across the community about the great things that are happening in Waco and just bring you up to date on what's going on. I'm Larry Holsey, Director of Municipal Information and Communication. Today, I'd like to welcome our new mayor, Dylan Meek. Dylan, thank you so much for taking time out because I know how busy you are.
Larry, it's so great to be here.
Yeah.
So fun to get to talk to you and viewers or listeners at home about some of the exciting things that we're working on and doing here at the city.
Absolutely. Real quick background for people because you've become mayor as of the November 3rd election, which is really kind of weird because prior to that, I think 2015 to 2020, you were the District 4 council representative, which is the heart of the city, kind of the older part of town as it is, doing great things. And then just thanks to COVID, it kind of blew the May election out of wow, and you were running for mayor at that time. But the problem was you didn't know what's going on, and you had already made a decision to move your house and not very far. Talk real quick about that and how that transition just really kind of kicked you off the council for a while.
Yeah, that's right. Joy of my life was getting to serve for 5 years on city council representing District 4 and was anticipating this May election and had before COVID and the effects of COVID had been realized for sure. We had gone under contract to buy a house and sell a house, never thinking that the May election would get tossed. So moved just a couple blocks outside of the District 4 border and just thought, well, contractually we would have moved after the election. So win, lose, or draw, at that point it wouldn't have mattered what district we were in, and looked all over the city and every part of the city, including District 4, but just didn't find anything. Found the house that was right for us just a couple blocks outside of that border and thought, well, win, lose, or draw, we'll move after the May election. And then the reality of COVID kind of came to set in, and that election got pushed. So took a temporary break and was really so great to kind of step back and get to see the council continue to work so well in a really difficult season with COVID, and they did such a good job. So it really was neat and interesting to get to see it from a different perspective.
Yeah, it is. And Mayor Deaver carried on the baton, as it may be, until November, past his normal time. And he has already gotten into it and started and did a marvelous job. You'll make any comment about that?
He's just, selfless leader, always mature, always thoughtful in his approach, and was just a great example to me on how to lead well, and was continually selfless, and I think always was thoughtful in making the right decision for Waco, and so we certainly miss him. I still call him regularly. In fact, I got a missed call for we were playing phone tag a few minutes ago to bounce ideas and what's the backstory here, or what is some wisdom that you can give me here. So again, so thankful to have a relationship with him where we can